Everybody has back pain at some time in their life, and it's not much fun. Some of us only have it occasionally, some people have it recurrently, and some of us are almost incapacitated by constant pain. And there are many different causes for it. It's important to make a diagnosis, because you would treat somebody who has osteoarthritis different than you would somebody who has rheumatoid arthritis or has an autoimmune condition, or maybe has osteoporosis or fibromyalgia or a problem with muscle or ligament problems, or maybe is on a drug like a bisphosphonate that can cause pain in different areas of the back and different parts of the body. So knowing the diagnosis makes a difference in the treatment, and that's why we should do the best we can to make that diagnosis. But once we have it, we want to get rid of that pain, and almost at all costs. And generally what we resort to first are analgesics, and oftentimes we use the ones that are over the counter. So things like aspirin and Tylenol and Advil and Aleve and Motrin. If we go to the doctor, maybe something like Celebrex, or maybe we'll wind up with some kind of narcotic. I have some patients that are on morphine patches, and that doesn't relieve their pain. And it's a huge thing that's important. Occasionally we'll use injections into the back in what's called an epidural injection, or we'll put something in that has a steroid to reduce the inflammation and something like lidocaine to relieve the immediate pain. So there are a variety of ways that we can do this using analgesic medications, but there are things like electrical stimulators, the TENS units that a lot of people have implanted in them because the pain is so severe, and it helps some. Massage and physical therapy, another real good thing to do. What I like to do oftentimes is use a chiropractor early, because if our alignment is off, if the spine isn't aligned right, you're not going to have a very good chance of having the biomechanics right. And if they're off, that puts stress on the body. So chiropractic alignment done by a competent chiropractor is one of the first steps I use. Acupuncture is another good way to do it. Imagery and hypnotherapy, good adjuncts to use. Qigong is often used. In my office, we've been using something called infrared light therapy or photonic stimulation, which uses LEDs, light-emitting diodes, at about 860 nanometers that put out infrared light that does some rather remarkable things to relieve pain. And as you go through this site, there are many areas where you can look up photonic stimulation or infrared light therapy to learn more about this interesting technology. There are also interesting approaches that are used by some complementary and alternative medicine doctors. People are doing things like proliferative therapy or prolotherapy, where when the ligaments are loose and you can't maintain the anatomy and architecture of the joint, sometimes that can shorten and tighten up those joints so that they don't get out of place so easy. In oxidative therapy, we're injecting things like ozone into joints has made a lot of people recover when they thought it was impossible and that surgery was the only option. And then, of course, there is surgery. We can do surgery, but it ought to be the last thing we do, because all too often when we do a surgical procedure and it doesn't work, what then? You've got a real problem. My philosophy is to use the approaches that make the most sense and to do them as a team effort. So I'll often want somebody who is a chiropractor to start out and see what they can do for alignment. We might add an acupuncturist to it. Somebody who does hypnotherapy or different kinds of body work or physical therapy in conjunction with the infrared light therapy works in almost all patients that I've seen, even ones who have been ready for morphine pumps. So there's a wide range of things that can be done. What you get will depend on who you go to. If you go to somebody who is a fairly narrow practitioner and thinks only their discipline is the one that works, as so many practitioners are like, you're going to get that therapy and it may or may not work. But if you go to an integrative center, as we have and have been doing for the past at least 10 years, you can get this team approach that simultaneously works on you, and results are apt to be an awful lot better.